Okay, good afternoon everybody. Welcome to the webinar on nurses in social care, meeting the new standards of proficiency. Please do ask any questions in the chat box as we go along, but be also aware that your comments are viewable to the public. So I'm Christine Wint, I'm the project manager for regulated workforce in skills for care. I have two other further presenters with me this afternoon, and who's Susan West, Senior Nursing Education Advisor for the NMC, and Simon Jones, who is a NICE Fellow and Consultant Nurse from Oxford. So, and I'll let them say hello.
Hello, yes, I'm Sue West. I'm from the Nursing and Midwifery Council, and I've been leading on the implementation of the new standards, so I really look forward to presenting some information to you around those shortly.
And I'm Simon Jones. I'm a learning disability nurse consultant and a NICE Fellow, and I've worked on two of the NICE guidelines, so we'll be talking about that element in particular.
Next slide, please. Thank you. So I'm talking to you today around the statement of role with regards to the nursing contribution in social care. It was based on a piece of work undertaken by Skills for Care in 2019 to look at and to look at the role of nurses in social care and to raise their profile and to highlight the contribution that they make to nursing in the widest sense. So just a little bit of background. Next slide, please. That the adult social care sector workforce employs 42,000 registered nurses. The statement of role provides a description of that role and the knowledge and skills employed by registered nurses who work in the adult social care sector in England. And it's quite wide-ranging, and some of the themes that came out of the project work was that they were largely involved in hospital admission avoidance, early discharge, and very much managing long-term and enduring conditions. But they were heavily involved in prevention and public health work and reablement and health and well-being of their users across the social care sector. So in addition to that, the piece of work that you can go onto Skills for Care website and search for yourselves is the document that has been published, and I'm sure you'll find that an interesting read and something we'd like to point you to the direction of. The work that was undertaken really highlighted that nursing in social care was a distinct role within the nursing family. They displayed distinct expertise and very much in enabling individuals with care and support needs to live positively with multiple long-term and complex conditions, and that included those on the end-of-life trajectories. What we found during our work was they embodied the capabilities and cultures of both the health and social care professions and brought together the skills, clinical skills, but also the social care elements of caring. They employed a significant amount of nursing knowledge and skills, and there was a heavy focus not only on the individual's condition and the resulting impairment, but also on the impact that has on their participation in social and community life. It is a very heavily relationship-based approach to supporting well-being in the community, and registered nurses are central to their role is affording time with the people in their care and their families in order to gain an understanding of their personal stories, their needs, wants and ways. So taking a very much a holistic approach to caring of their users. And they regularly undertook and used bespoke communication methods to relate to people who may not be able to use spoken word. Nurses were very confident in working flexibly to take account of an individual's behavioural needs. And they used everyday, ordinary life activities such as putting the kettle on, making a meal, or simply helping someone to participate in social occasions as a way of building and maintaining these human relationships. But at the very heart of their work is that person-centred nursing practice, looking at the person as a whole and enabling the development of deep human relationships which led to a high degree of trust. And it means that registered nurses are in a prime position to act as advocates and enable the people they support to have a voice, exercise choice and exert control with regard to their own health and well-being. What we found was that nurses who deployed person-centred care, it enabled detailed understanding of a person's physical, social, emotional state at any one time. And there was a recognition of the normal patterns of complex health needs, which supported the use of clinical knowledge, the skills, and facilitate a person-centred decision-making approach in their nursing practice. They were able to promote the health of clients and users, support and maintain them when they were unwell, and respond to their presented and developing needs in a very unique way. And if we go on to the next one, that's just diagrammatic. What we also found that registered nurses in social care are absolutely accountable health professionals and take overall responsibility for the assessment, evaluation and review of individual health needs. Very often dealing with complex but using evidence-based clinical decision-making in all of their care. They're very much leading in the planning and coordinating of care plans and liaising with external stakeholders. It was found that they were very apt at appropriate delegation and supervision of assistant practitioners and carers, and at the same time responsible for being operational managers of the service. And depending on their position, they would act as responsible person on a typical shift and take responsibilities for lead visits such as a CQC visit. Next slide, please. What came out of the work was that registered nurses within the social care sector operate in a very complex regulatory and organisational landscape. And they have to operate within high levels of autonomy and within a complex range of legal and regulatory frameworks, which we found that they were very competent in. And frameworks such as safeguarding, ensuring well-being and protecting the human rights of their users. They regularly grapple with the legal and ethical dilemmas concerning such things as an individual's capacity, for example, to give consent, the involvement of their family members, and positive risk-taking in relation to health and well-being. All of these scenarios that I've alluded to earlier involve very sensitive, high-profile areas of decision-making and require a sound legal understanding of record-keeping, in particular to ensure compliance with the relevant local and national protocols. We found that they operated in this large system way and made very good connections and worked collaboratively with GPs, hospital clinicians, physios, OTs and social workers across the social care sector, and also working with housing providers. It is a multifaceted role, managing complex health issues, the day-to-day management of registered homes, and also being able to work across systems collaboratively to ensure that the best care and the highest of care for their users.
Hello, it's Sue now. I'm just talking to you more about the NMC regulation and the education and standards for nursing, and I'll also touch briefly on nursing associates because I know some areas have now got nursing associates in this space. So I would just want to start off really by talking to you about the functions of the NMC, which is on my next slide. And as a professional regulator of nurses, midwives in the UK and nursing associates across England, we work to ensure that the professionals have the knowledge and skills to deliver that consistent quality care that keeps people safe. We set the education standards professionals must achieve to practice in the United Kingdom when they have shown both clinical excellence and a commitment to kindness, compassion and respect. And we welcome them onto our register. We've got now more than 700,000 professionals on there, and that includes the nursing associates. So you can start to see on this diagram where registration fits in. Once registered, nurses, midwives and nursing associates must uphold the standards and behaviours set out in our code so that people can have confidence that they will consistently receive quality, safe care wherever they are treated. And we promote lifelong learning through revalidation, encouraging professionals to reflect on their practice and how the code applies to their day-to-day work. And again, this diagram is showing you where revalidation sits. And you will also see that you've got the standards where we set the standards both in the code and also the standards for nursing midwives and nursing associates. And finally at the bottom, with regards to education, this is where we approve and quality assure programs for nursing and midwifery education. But on the rare occasion that something goes wrong or the care falls short of people's expectations, we can step in to investigate and take action when needed. But we want to prevent something from going wrong in the first place, so we will promote a culture that encourages professionals to be open and learn from mistakes and gives the public an equal voice, and where everyone involved is treated with kindness and compassion, and that sits within our fitness to practice area. So it just gives a reminder to you of the areas and functions of the NMC, and we all have to play our part there. But I want to move on to my next slide, which talks to you about the education programme that has now been in place for the last 5 years, and we are nearing the end of our approvals and development of our new standards. So this diagram is showing you across the coloured block boxes in the middle that we've actually developed a number of standards for all of our professions, except in the bottom long green box that is around post-registration, which is currently under review. So the standards talk about, at the top, standards framework for nursing and education, and these are the high-level standards that education providers and their practice learning partners, which if you're working in the environment of nursing, then within social care you may be providing placements for students, so it's a learning experience, so you may well be a practice learning partner. And standards for student supervision and assessment, which is the new standards that are going to replace the old, what we call SLAP standards, if you're familiar with that, the students learning and assessment in clinical practice, and these are replacing them. So we will no longer be talking about mentors and mentors and sign-off mentors. We will be talking about practice supervisors and practice assessors and academic assessors. So I really commend you read some of these documents, but you'll see these in a moment on a better visual. But what we have now is we have the future nurse standards and proficiencies, the nursing associate standards and proficiencies, the midwife standards and proficiencies, all now published and available on our website. We have also got new standards for prescribing, and we've also adopted the Pharmaceutical Society competency framework that underpin and support prescribing practice. And finally, we've got return to practice, and some of you may well be very interested in return to practice, because the return to practice standards now offer two options to get back onto the register. One, through undertaking a return to practice programme, and secondly, somebody can come back by undertaking a test of competence, which our overseas nurses coming into the country currently do, and it will be the same test. And this option is now live and available for people returning to practice. So if we can move on to the next slide, this is a diagrammatic picture of our new standards. So starting from your left to right, the high-level standards framework, the supervision and assessment standards, and these two sets of standards, which is part 1 and part 2, apply to all of our programmes, and so everybody needs to adhere to those. Then you've got the programme standards in the middle, and that's our library of standards that you've already seen on the previous slide for each of the professions or programmes such as prescribing. And then in the diagram there, you're seeing the standards of proficiency for nursing and midwifery professions, and so that's where our standards of proficiency will sit. So what I'm going to do is really just concentrate a little bit more now on the new standards for registered nursing, and that's what you can see there. The two boxes that you've got are the standards of proficiency for registered nursing. I'm hoping you can see the teal colour of that box, and then part 3, the standards for pre-registration nursing programmes. And all of these standards need to be met by education providers alongside their practice partners in order to support students, enable them to learn and meet the standards going forward. Now, the future nurse standards of proficiency are very ambitious standards. They're taking us into the future, and the next slide will really explain to you why we're doing that. Because the future health and social care needs of people is now more complex. You're finding that within your practices already. It's that people are more vulnerable, there's more frailty, more lifestyle diseases, older, more comorbidities, the multiple pathologies, and it affects people from the mental, cognitive, behavioural and physical health. It's not just about physical health, we need to cover all areas. And our new standards, although we have fields of nursing, all nurses who will be registering following achievement of all these proficiencies will have had exposure to all 4 fields as well, and that is an expectation. We've also got service pressures, they come into being as well. There's greater demands, there's increasing costs, we've got all the workforce challenges that we're working through. So we need to have resilient people who are coming into the profession to be able to work within these challenges. And our potential future nurses have great career aspirations, they have different lifestyle choices, they want job choices. Everybody wants job satisfaction and self-esteem and self-actualisation, and it comes through empowerment. And empowering our students in the future is really, really important. So let's have a look at the future nursing proficiencies here on this slide, and what I want to focus on are the key changes and make sure that they you're identifying some of those differences that are occurring, but I also want to align them to what you can do and what they mean for you in practice. So they are set across 7 platforms, and if they are so on these platforms, you can see that they're about being an accountable professional, promoting health, preventing ill health, assessing needs and planning care, providing and evaluating care, leading and managing, improving safety and quality and coordinating care. And how is this now aligning to what Christine has already been talking about of the nurses that are working in social care is absolutely key. And on the key changes, some of the things that are coming out is the fact that we will be expecting people to be this greater emphasis on that communication, relationship management, but there's also the element around public health is coming out central. The other aspect, of course, is also person-centred care, and I'll come on to that in a moment. All nurses undertaking programmes in the future against these new standards of proficiency will have had greater detail around pharmacokinetics and the knowledge of prescribing practice. They will have done whole body system assessment, which means that they will be much more prepared to take on a prescribing programme of study to become nurse prescribers in the future much sooner than they are now. I've already mentioned this focus on mental, physical, cognitive and behavioural health, and it's absolutely central that we all have an understanding of that. And students, when they, at the point of registration, when they qualify, will be able to support and supervise other students as well. It will become part of their programme. So the new pre-registration nursing midwifery and nursing associate standards do talk about general terms. They don't talk about hospitals, so this is across of varying boundaries and sectors and settings. So they do apply to social care in the independent sector as much as they do to those people working in hospitals. They also are looking at the sort of leadership of teams, including the regulated and unregulated and volunteer staff in the workforce as well. So they're very key to that. But as we've already heard from Christine, nurses in social care need to provide person-centred care and the need to be able to lead and enable others. And we'll focus on this, just taking really two of the platforms that I'm going to focus on, just purely as examples really of what we will do. So if you look at platform 3, assessing needs and planning care, this is about registered nurses prioritising the needs of people. We've mentioned all of these areas before, and it really is about using the information to obtain during the assessments to identify the priorities, requirements for that person-centred, evidence-based nursing interventions and support. And this will be about how they work in partnership with people to develop person-centred care plans and take account of their circumstances, characteristics and preferences. And this is then about reasonable adjustment. And only today on Twitter it was lovely to see that somebody said this is what nursing is about, where they had two elderly people on the same ward where they were the wife was severely ill, and they managed to put them both together bedside by bedside in a side room so they could be with each other, having been married for 65 years. And when you're moving towards end-of-life care, that is absolutely vital to make sure that relationships are kept together as best they can be. So the standards themselves are outcome focused, and they do not tell you how, but there are numerous evidence-based resources available for you to draw upon. So I'm just taking an example of one. So one of the proficiencies, 3.4, states understand and apply a person-centred approach to nursing care, demonstrating shared assessment, planning, decision-making and goal setting when working with people, their families, communities and populations of all ages. And that's word for word. So if you look at the NICE guidelines, for example, support patient-centred care and the pathway for home care for older people, the overview and person-centred care is a good example of some evidence that you can use within your general day-to-day care of people. And the clinical guidelines will also provide that evidence base to support nursing interventions too. 3.5 is another one, and this is around demonstrating the ability to accurately process all information gathered during the assessment process to identify needs for the individualised nursing care and develop person-centred evidence-based plans for nursing interventions with agreed goals. So it's absolutely central to these standards that person-centred care is considered and it's working with people, not for people. And if we have a look at this one now, the Platform 5, leading and managing nursing care and working in teams. This one again is showing you that registered nurses provide leadership by acting as a role model for best practice in the delivery of nursing care. And so students in the future need to start to look at leadership and how they can demonstrate leadership from the day they start their programme of training. They are responsible for managing nursing care and are accountable for the appropriate delegation and supervision of care that others provide within the team as well. And that includes lay carers. So it's really looking at how that all comes together within your day-to-day work. And they play an active and equal part in the interdisciplinary team. So the collaboration, the communication and effectively working with others that we've already heard from Christine comes into play just looking at this Platform 5. So, you know, you've got some really rich learning experiences for students in the future to meet these proficiencies. And just as another example, within Platform 5, one of the areas here is demonstrate an understanding of the roles, responsibilities and scope of practice of all members of the nursing and interdisciplinary team, and how to make the best use of the contributions of others involving and providing care. So again, you can draw upon the nice pathways around service organisations to achieve this. And so there are a number of others which I won't go into now, but 5.6, for example, exhibit leadership potential and demonstrating the ability to guide and support and motivate others. Absolutely vital to achieving the overall outcome of Platform 5. So that's just giving you some examples from a nursing perspective, but let's just have a look, because there's always, people are always asking me about our standards for nursing associates. You'll see these have gone from a teal colour now to a nice bright orange that we use for our nursing associate standards. And so, in uniform, we've got the standards of proficiency, we've also got the standards for the programmes for nursing associates and what they look like. And the next slide will just show you that similar to our nursing standards, the nursing associate proficiencies are set across 6 platforms, and they too will have 2 annexes, one on communication and relationship management skills and one on procedures undertaken by nursing associates. And so if we then look at that, one of the key questions that we get asked is around what is the difference between the nursing associates and what they do as to what a registered nurse does. So if we can move on to the next slide. This slide is actually showing you the future nurse platforms and then the nursing associate platforms, and it also puts emphasis in what the registered nurse will do at the point of registration that's different to that the nursing associate does. So the future nurse will be assessing and planning care, and they will also be evaluating care. The nursing associate will provide and monitor care, and there is a key difference of work between the two because it is a support role. And then you've got leading and managing nursing care from the RN, and also the coordination of care, whereas the nursing associate will contribute to the integrated care, and they will also be delegated work from the registered nurse to the nursing associate as well. So this slide just really provides you with some areas that are different between the 2 roles. I'm just going to take a couple of questions, if I may. We've got lots and lots of questions coming through, but I've just had one here from Claire about, can the return to practice course be held in a care home? So really, the difference here, Claire, is that the return to practice course will be a course that's run from an education provider because we will need to approve that programme of study. And when we do so, it will really depend on how innovative their programme is, how flexible their programme is, as to whether or not the programme can be run in conjunction with yourselves. But it will be possible that for somebody who's wanting to return to practice and they see their scope of practice within a nursing care home, that they might have that as their placement. That's where they want to demonstrate their key proficiencies to be able to return back to the register. One of the things that I have been talking about just recently, though, is with regards to the undertaking the test of competence. It is possible for employers to actually consider doing a recruitment drive for returners to come back into social care, for doing nursing care, for taking out activities, and actually think about how they can prepare people to undertake the test of competence to get back onto the register. And that's an opportunity for all employers. So not fully answering your question, Claire, but I hope that goes some way. I've also got another question here, which is, where do standards and proficiency nurse trainee practitioners sit within the local government authority who aren't recognising practitioner nurses equal to social workers? It might be something that I might need to unpick a little bit more detail about what's meant by that. But if we've got student nurses or student nursing associates who are undertaking practice learning experiences, if you go back to the slides earlier on where I was talking about supervisors and assessors, they will have to be supervised, and they will have to be supervised by a registered, either a registered nurse or a registered health and social care professional. So somebody like a social worker could be a supervisor to nurses and nursing associates, as long as they're prepared to undertake that role and they also have the knowledge and skills to support the learning outcomes, and that would be reasonable to do so. And again, Anne, sorry if I've not fully answered your question, but it goes some way into sort of talking through the need for supervisors for students whilst they're on practice learning experience. So I'm going to stop there for now. I'll have a look at some of your questions and we can come back and answer some of those again in a moment, but I'm going to hand over to Simon.
Okay, thank you very much. So I'm Simon Jones and I'm a learning disability nurse, so that's my area of expertise, but I think what I'm going to be talking about is the relevance of NICE to nurses, all branches of nursing working in social care. But I'm using my area of expertise as an example of that. If we go on to the next slide, no, somebody's throwing, that isn't the slide I was expecting. Can you go on to the next one beyond that? This is, that's better. That's more like, thank you. So NICE produced guidelines and standards, and obviously NICE started off producing these principally for health, but now they are the National Institute for Care and Health Excellence, so it's care as well. And the two principal things that they produce are the NICE guidelines and the quality standards. The NICE guidelines, comprehensive set of recommendations based on the best available evidence. So they are a really useful tool for all of us working in whatever aspect of healthcare. They're very much focused on person-centered care. They are developed by independent advisors, and I know, as I've said earlier, that I was involved in putting together two sets of guidelines, so the rigour with which the research evidence is analysed and synthesised to produce the guidelines means that practitioners can be very comfortable in relying on NICE guidelines as being really good evidence-based practice. And similarly with the quality standards, they take the guidelines, they look at what are the key components there, what are the measurable components within those guidelines, and identify normally about 5 or 6 quality standards, i.e. things that if we achieve those, then we know that we are by and large meeting the guidelines, the NICE guidelines. Next slide, please. So thinking about my area of expertise within learning disabilities, there's a number of standards and guidelines that are out there that are of value, but I think, as with all these things, they're relevant to all branches of nursing, all branches of social and healthcare. As you can see there, I mean, the titles that are singled out there, people's experience of adult social care services, decision-making and mental capacity is obviously key to all of us. Care and support of people growing older with learning disabilities is one of the guidelines I work with, and again, I think we found very much that the needs of people with learning disabilities as they grow older very much mirror those of the general population in terms of their overall basic needs in terms of planning, care coordination, etc. Another standard quality kind of a guideline was the ones around challenging behaviour, which I'll come back to in a few minutes. Other ones that are on there, mental health ones with people with learning disabilities, and then the last one looking at prevention and interventions. So if we could move on to the next slide. So there's another standard in development at the moment which may be of particular interest, which is safeguarding adults in care homes, and the scope, which is where it's at the moment. It covers identifying abuse in care homes, identifying neglect, managing safeguarding concerns about abuse and neglect, supporting people directly who are affected by such issues, multi-agency working, which is obviously integral to this sort of work, training and skills for safeguarding that are pertinent to all staff working in this area, and embedding that learning in organisations in order hopefully to prevent abuse and neglect occurring in the first place. Those particular, the draft guidelines will be out from the 7th of May, and everybody can comment. And I know from my own experience that all comments are welcome and are considered in considerable depth and responded to before the final guideline is put together and published. We move on to the next slide. This is just an example of a few publications by NICE which are particularly relevant to those working in social care. I won't go through them all, but you can see there's a good selection of those. And then if we look on the next slide, we can also see about resources that NICE produce for people working in social care. And if we move on to the next slide, there's also webinars similar to this one that we're running today, and there's a few there again which are particularly relevant to the sort of issues that we come across. For instance, giving medicines covertly, pressure ulcers, managing medicines, behavioural challenges, and intermediate care. Okay, going on to the next slide. I'm going to talk here about one particular set of NICE guidelines that I worked on, just to give you a flavour of how they are produced. So that particular one was called Challenge Behaviour and Learning Disabilities. I apologise for the language in advance. These were written a few years ago. We probably wouldn't call it challenge behaviour. We might talk about behaviours of concern, but that was the terminology that was current at the time being. And this particular guideline was intended for all practitioners working with people who have behaviours of concern, and focus very heavily around how such behaviours could be prevented from occurring in the first place, but then also thinking about where those behaviours have developed, what we can do to support the individual to develop new skills and new ways of getting their needs met. So it both covers adults and children, and it highlights the importance of understanding the causes of behaviour and the challenges and using scientific assessments. One of the things it doesn't mention in the guidelines is what we now call positive behaviour support, but that was because at the time the actual evidence base for positive behaviour support as a framework wasn't fully established. However, the guidelines do contain all the components of positive behaviour support. And the guidelines also cover support and intervention for family members and carers. And it was one of the, I remember particularly one of the evidence bases that we looked at around supporting families to understand functions of behaviour was particularly effective in helping them support their children to develop in more conventional ways, as it were. We look at the next slide. So one of the key take-home message from that particular guideline is that quality of life is the key. That if you're working with people with behaviours of concern, the behaviours of concern are the symptom, not the problem. And if you just focus on somebody's symptoms, you're unlikely to resolve the issues. The way to help individuals who display behaviours of concern is very much to focus on a multi-element way of intervening, and the key components to get right in that sort of scenario are ensuring people have effective communication systems, that they spend their time engaged in meaningful activity, that they are supported within a supportive environment, that the staff who are working in that environment have practice leaders and adequate staff training. It's been very clear that if staff feel well trained and well supported, they can be far more effective in that sort of environment. You also need to give people clear guidelines on how to manage a crisis and how to de-escalate things succinctly. We want people to use science, not hearsay, i.e. if you're working with someone with behaviours of concern, you need to be looking at the data. you need to be basing your interventions on solid accumulation of statistics rather than people's personal opinions, and so that you can learn from events in the past. If you do have a crisis situation, you need to both manage that situation but also to learn from it, so that if it does happen again, you're better prepared to support the individual. So if we move on to the next slide, one of the key messages about this particular type of working positive behaviour support is that it's very much focused on working, it's very much partnership working. At the centre of that partnership is the individual, but it's absolutely essential that it's a triumvirate between frontline staff teams and their carers, behavioural professionals, and the people managing the service. And you need all three of those working in harmony to achieve an effective outcome. Next slide, please. So the guideline, as an example of a nice guideline, provides the practitioner working in whatever environment, whether it be that the NHS but particularly in social care. We know learning disability nurses, only about 20% work within the NHS healthcare sector. The vast majority, about another 80%, actually work in social care or in the independent sector. So their requirement is just the same as everybody else. They need solid evidence-based practice. They need something that is practical. They need a guideline that is coherent, i.e. the parts of it make sense when all put together. We want something that's official, i.e. has that stamp of authority. We want something that's succinct, and I know perhaps for a lot of you reading nice guidelines, they don't necessarily look that succinct, but I think they are, considering what they cover. The guidelines are reinforced by quality standards, which, as I said earlier, are a really good shorthand guide to what are the key components of a set of guidelines. And I suppose the most important thing is they work. I've had lots of experience of implementing nice guidelines, and they do work. Next slide, please. And just here is a couple of examples that you could look at later around accessible information with people with learning disability, and that is under the information for public tabs. And NICE are now getting much better at producing easy read versions of guidelines and also videos. Have the next slide. Right, so that's the end of my little bit. I've got a couple of questions here. And so Anne has said local authorities don't always recognise LD nurses and their importance. And Anne, you are so right. I think that's partly because a lot of learning disability nurses go under other titles, and perhaps people don't even know that they are registered nurses. But you're preaching to the converted if you say that we're not recognising their importance. But I'd be interested in people's ideas as to how we go about doing that. So that was a question from Anne. And then Liz has asked, will there be nice guidelines for behaviour that challenge read dementia? Which is a good question, and I'm not sure I know the answer. I think NICE are quite keen to try and not have overlaps. So I would say to start with the guidelines around people with a learning disability that have behaviours that challenge, I have used within dementia settings. I have done a lot of work. I work for a mental health trust, and I've done a lot of work with talking to them around positive behaviour supporting, talking to nurses working in mental health, community mental health, inpatient settings, eating disorders. And I always start my presentation by saying, this is what positive behaviour support is. It was developed for people with a learning disability, but I think it's relevant to all. What do you think? And at the end of the day, nearly everybody said, yes, there's lots of stuff in there that I feel I can use. So I would refer you, in the first instance, to the NICE guidelines around challenging behaviour and learning disability. So just rounding off my bit of the presentation, there are links on there for see about experts by experience talking about and developing nice guidelines. One of the really useful things in the second set of guidelines I worked on, which was related to people with learning disability as they get older, was that the guideline committee was made up of 3 experts by experience, and that really added to the quality of the discussions and the insights that we gained. I think it's all very well when you're looking at putting together guidelines and talking about what should happen, but when you've got somebody sitting in the room saying, well, I went to my GP last week and this is what happened to me, it really helps you to be grounded. Okay, to the next slide. Here is just some information regarding getting some extra support. And you may not be aware that the NICE have a field team and who cover a geographical area. And again, I've had the experience of working with them. They are very keen to help people understand how they can use NICE guidelines in their workplace. And I think they particularly care on linking up with people working in social care, local authorities, etc., i.e. moving beyond NICE's sort of original remit. The next slide. Yeah, so this is my last slide around where you can get more information. So that's my bit. I can now, got my colleagues sitting here who've got some questions, so shall I?
Lovely. I think I just wanted to come back to a point that Anne made earlier about the lack of recognition or lack of equal recognition of nurses to social workers, and just really wanted to say that the work that Skills for Care did around the statement of role and the nursing contribution seeks to raise the profile of nurses across social care, and there are increasing discussions across health and social care and the Department of Health and Social Care about the role of registered nurses, and that includes learning disability nurses. And their role in the social care and their contribution that they make to the integrated care agenda. And I think that profile is being raised, and that point has been taken on board. And I think that there is lots more work to do around how we raise the profile of nurses in social care. So I just wanted to really make that point. And then the second point, Anne, you raised was about revalidation, and that local authorities don't recognise the need for nurses in social care to undertake revalidation. I think we are moving in a very positive way there, that most employers are now recognising that nurses, as long as they're using their nursing skills and as long as they're registered on the NMC, they will need to undertake their revalidation, and employers will need to support that. And we are providing some guidance shortly around from Skills for Care around creating a supportive learning environment, and how we can support nurses in social care to maintain their registration and how to revalidate. So watch that space, that will be coming out shortly. I think the other question I think was again raised by Anne was around how can nurses sign off or assess social workers as social work students. That's something that I think you would need to go to the Social Work England website. We know that it's probably unlikely that nurses can actually sign off social work students, but I think in order to get confirmation of that, I would urge you to go onto the Social Work England's website, where you'll probably find some guidance.
Okay, and another question that I picked up on, and I think Kirsty, you were talking too about revalidation, and there's also an element of what you referred to as what a typical nursing domain in where you're working. And I think that what we need to do is start to challenge what is typical with regards to nursing, and in the environment of neuro rehab, then using your nursing skills in that environment is really, really important, and how that can be demonstrated. And for all of you who are nurses who are working in any of these environments, in order to meet your revalidation requirements, please do use the standards of proficiency as a tool to actually look at how you can focus your learning more to the future nurse standards moving forward, so it helps your development. It means that your scope of professional practice will be enhanced within the work that you're doing, and you will also be able to link that back to developing your reflections, etc., and be able to revalidate. But more importantly, that's what the code tells us all we should be doing. So I just really recommend that you look at that, you focus in on your nursing skills and support that. So thank you, Kirsty. You've come back and said they've probably been never been tested more in the work that you're doing, and a really valuable area of work that you're doing too. So I hope that helps everybody around revalidation.
I just respond to Lynn talking about raising the profile of learning disability nursing, and she suggests that we need some collaboration at a national level. And just to say that NHS England is hosting a learning disability nurse collaborative, no, I can't think of the right word, but anyway, an initiative to try and raise the profile. But I think the other thing I would ask practitioners is to make sure that when they're talking to people, they acknowledge that they're a nurse and just let people know. I think it often gets, as I said earlier, hidden. Yeah, do we have any further questions?
I think I'm just picking up on Kirsty's comment about guidance for revalidation in these areas would be really valuable. Kirsty, it'd be lovely if we could work with you perhaps to have a look at how you've been doing yours, and it may well generate a case study that we can use. So we'd rather use case studies that have come from practitioners around how they are doing that, and we're currently looking at revalidation and looking at simplifying some of the elements, but the more opportunities we can demonstrate how nurses in various areas work and revalidate, the better. So Kirsty, it would be good to touch base. I'll see if I can pick up on your email address later.
And I've just remembered the name of the Learning Disability Nursing. It's a Learning Disability Nursing Symposium. It's been hosted by NHS England, and David Harling is the lead for that, so it might be worth, if you're interested, to contact him.
There are just lots of points being raised there about raising the profile and the value of nurses in adult social care. I think there's a point from Catherine Charlton at the bottom about please can we have another session that considers nursing in domiciliary care. Catherine, much of the work that we do around schools for skills for care and nursing actually crosses both those in residential and domiciliary care. But take your point there that we could probably look to have some more guidance or some more information on our website that's specific to dom care. So thank you for that point.
And also, Gareth, I noticed that you're saying about conversations in Scotland. You'll be pleased to know that we have been working with all 4 countries across the UK with regards to implementation of the new Future Nurse standards, and likewise doing it for Future Midwife. But this will be around how we work with and support the Future Nurse, Future Midwife implementation boards, who are then working with representation from across the country of Scotland to be able to look at implementation. And yes, you're right, it is, social care is different, and there are a number of social care workers who are registered in Scotland as well, which isn't unlike England, and we've been looking at how it does work differently. So yes, conversations have been happening there. The landscape is different, but actually, you know, if you are nurses working in social care, it's about your nursing skills, it's about how you're working within the code and how these new proficiencies can help you move forward in the future too.
Okay, do we have any more points we want to make, or are we done?
No, I just wonder whether it's worth asking the audience if they've got any final comments or questions for us to consider in the last few moments.
Yeah, we've got 5 minutes left. So somebody's typing, I can see on the screen. Oh, right. No thanks is the answer. Okay, well, in that case, I shall just thank the speakers from today. So Christine Wint, who was Project Manager at Skills for Care, Susan West, who's the Senior Nurse Education Advisor at the NMC, and Simon Jones, a nice fellow, and Oxford Health NHS Foundation Trust. It's goodbye from me.
And goodbye from me.
And goodbye from me.
Thank you, everybody.